This is Desiree Dubonnet, Professor of Medicine, and I'm the owner of the intellectual property behind this quantum biofeedback. And today we're looking at a presentation about the animal use, the veterinarian use. Keep in mind that the real machine can only come from QX World, and that Mandalay was using a fraudulent piece of software that they stole from me over 10 years ago. And the software they stole was in demo mode. It doesn't work. It's counterfeit. It only seems to work. It doesn't really work. And if you want any type of proof of this, let me know. Or if you want to have a conference call, let me know. We could discuss this. But today, we're going to be showing a presentation that was using the correct software from the past. And today, we're going to be talking about its use with animals and veterinarian clinic. Welcome.
My exercise is to tell you about the new protocols and the new accessories for the animals. I'm a veterinarian. I went to the University of Veterinary Medicine in Budapest between 2001 and 2006. Afterward, I have been working at the veterinary ambulances also. Because of my own disease, I found this SCIO, and I liked it so much that I started to make praxis with the SCIO also. And now I'm only working with the adductor half a year ago. I live in Szeged in South Hungary. So if I want to treat horses as well, I have to go to Budapest because my father-in-law is a trainer, so I can cure and I can also practice to cure the horses, which are trotter horses. Now I want to speak about the differences between SCIO and adductor. I think both of them make warranty to get the precious 100% frequencies, the exact frequencies. I think adductor our outcomes after a long and mature development is more intensive, as Desiree also told us today, 3 times better or even more better with the power as the SCIO. It's also faster, and what I also could see that it's more exact in diagnostic, especially for the soul, which is also different, and it's very important for the animals that adductor has no disturbing LED lights, because when I cure the cats likes to play with LED lights. And I always saw that especially the young cats want to play with the LED lights in front of the SCIO. The new accessories, which I also will tell you, are easy to use and are very practical for the animals. And now I want to show you the new accessories and the protocols with a real animal, with my new patient I also haven't seen before. So I want to introduce you, Nobby. I will get him here. Jöhettek. Okay, he's coming. He's on the way. So his name is Nobby. His name is Nobby. He's a stallion. He's 9 years old, a trotter horse race. Now we can make the calibration and the testing. And we will use a halter. It's a new accessory. It's very good for the horses. As you can see, it's a daily routine for them because they are also using a halter. And so they can be more calm if we use the halter. And we also introduce you the horse blanket. It's also a new accessory. Both of them are really a daily routine for them. Horse blanket they always use after a training where they have excessive sweating. So afterward we have to clean and wash them. And because we don't want them make sick and ill and cold, we always protect them with a blanket. We have this blanket in 2 types. For summer, a thin one, and for the winter or for the autumn, also a bigger one. We have on the blanket the electrodes, and which is very good with the new accessories, that these are now parts of the harness. So you can use on the head and on the limb electrodes. He's a very calm and a shy horse. He used to participate on horse races, trotter races, and I started to cure horses, not him. I haven't seen him before, but 2 other ones and more who are very, very good at horse racings, but they had weather injuries or other problems, which I will tell you later. As you can see, we can also use the halter. We can also use 2 halters. It's not necessary to put down the other one. The horse halters we have in 3 different sizes. Depends on the breed, because each breed has a different size of head. What is also important, near to the ears, you have to use the red and the yellow electrodes, and near to the mouth, you use the blue and the black one. Soon I can start with the calibration. So as you can see, I made the profile. He's Nobby. He was born in 2007. He doesn't need any medicines. He has we will see, but I know that now I know that he has not problems to use medicines, which needs medicines. I put 8 for the personal stress because he participates on races, and as we know, also in humans, when you have to train a lot and when you have to participate on races, you have a higher adrenaline level and a higher cortisol level. He had This is a new accessory. This is a halter where you have the electrodes. So you don't need the head one. You don't need the head one. Because I started to cure with SCIO horses, and I tried it with the head electrodes, but it's little, it's very small for them. So I had to fill up. I had to fill up near to the neck, the head one. I wanted also to tell you that you have on the package, everyone got a package where you have papers. On the papers are the prices of the accessories and also the prices of the SCIO and the adductor, so you can see the prices on the list. Okay, I will show you later how you can make a profile, but I want to have him calm. Okay. And now calibration. As I told you, these accessories is a part of the harness, so you can use it with the fast calibrating. I don't know. I haven't met him before. We will see. We will see. I only want to calibrate and to test, and then he can go back home. Yes, especially for announcement for the new accessories, and I wanted to show you the treatment protocols which I make, and I thought it would be better if I would make with a new and with a live animal. Okay, now. So, as I told you, finally, these following electrodes are available in the market now, are practical in many different ways. Able to use for a lot of animal races. We have also new electrodes, new accessories for pets as dogs and cats. And as you see, especially for horses, we have 2 new accessories. There are more variations depending on the size, on the breed, on the location, and on the nature of the animal. I think these new accessories are protective of your machine, of your SCIO and adductor, because they have special connection and longer cables. These are very important in case of horses, because Nobby is a great guy, but the other ones can be bored during the cure, and they want to move and they want to go. These are also more comfortable for the animals. As you can see, it's not disturbing for him. Even the blanket not. There are 3 different types. Pet for pets, dogs and cats. With these electrodes, pets are very calm because it's more comfortable and they don't feel tied up. It's also more surface to get the frequencies up. I have to check where we are with the calibration and the testing, and I will continue as soon as possible. Okay, calibration is ready. Now to testing. We don't make a EEG, we did it. Okay. Now back to the horse blanket and the halter. As I told you, it's not unusual for trained horses. It's daily routine to use blanket after training. With the horse blanket, you have more surface to get up the frequencies. And the halter is also a daily routine for the horses. It's very protective for the machine because you can control the movement of the head with the halter. Only for horses are in different sizes. So I think these are very great. As you can see, it's my cat, Dennis. It's my favorite patient. When I cured him, he was very calm and he wanted the cure. He could get up the frequencies, but after a while, when I started the cure, I put the halter, the head electrode on the back. But after a while, he moved. He wanted to change position, so he lied on the head electrode. So I think this photo can also show you that for pets, especially for cats, are the pet pad very good. Because he can move, he can lie on it. As you can see, he likes this blanket in which he was lying. Okay. Another check. Okay, we have moments. Okay, and these two were also my patients. The first is Tesco. The other one is Talisman. It's also my... the white one is my horse, and both of them were cured with a halter and with the adductor. Talisman had problems with the leg. He injured it, but it was not a big injury, so he could run after the cure. About Tesco, I will tell you, he's an example for me, so I will tell you more about him. Okay. Now we have to wait for the testing and... Okay. As you can see, we can also check the oxygen level. The oxygen level in his cells, also the hydration, which are good. A little bit the oxygen level is under the 70, but it's not a huge problem. A lot of horses have digestive problems. And have problems with the gallbladder, so I think it's healthy. It's not a problem. The oxygen level in the cells shows us very important things for the stadium of the liver and the gallbladder, because you have a small oxygen level. It could be problems with the gallbladder. The cells vitality is also good. It's 5. I think with a race horse, you can see how many energy he has with this level, with the cell vitality level. Because if he's exhausted, he has no energy, the level is much lower. With the pH, it's not problem because he's eating vegetables. Mindjárt kész. Jó. We will finish. I try always to cure them as they would be humans. So I also take care about his souls, their souls. Okay. Okay, we are ready. Thank you. Okay, now I can show you the protocols which I always make. After the calibrations, I always use as by the humans also the kidney stones. It's very important. After the kidney stones, I always look after the COS at the EPR enhancements. And meanwhile, okay, thank you, Nobi. Meanwhile, I always push the iridology and the body viewer also. I think both of them are very important. At the body viewer at first, I will tell you which programs I always do. As by the humans, I always do the individual movie program, afterward the unconscious choices, and then the show affirmations, show mental conflicts, show disease states, so we can see a lot of things from them. And because I also want to cure them from old traumas, I always treat with the 3 disease path of all trauma. And then it depends on the problems. I cure the circulation system for the race horses. It's very important because they have a very heavy, very strong trainings and entertainment. So they used to cure with the circulation system. Also with the digestive system, as we are by the horses. If you want, you can also check the endocrine program and the immune system program. If they have problems with the senses, with the kidney, bladder, and the lungs, I also push these programs. After these programs, I do by the acupuncture point the connective tissue, because all of the race horses have a bit problems with the connective tissues. It could be only musculospasms or a broken leg, or it depends of the strength of the injury. If the animals have allergy, I also make the allergy cure here. And if these animals have hormone problems, you can also push the hormonal program here. And the kidney and bladder program as well. And I had also animals, pets, a dog who had problems with the skin, so you can also use by the acupuncture point the skin program. As I told you, I always cure them by the soul also. So I always do some psychological programs here at the body viewer. For example, the relaxation auditory or the anxiety therapy. Or here at the RFE autofocus emphasis, the psychic energy stabilization. And if the animals, the horses, doesn't have any energy, you can also cure him by the therapies with the, or not here, here, by the SCIO therapy, the energy boost. It's very, very good program for them. A lot of times I also use the oral cleanse with the atherosclerosis, cancer, and the vibe foci therapies also. So it's about the body viewer, which can function meanwhile. At the mean program, I always check the things shown after the testing. A lot of times I can see here also the soul problems and also, for example, the vaccines which they had become, or even a flu virus which they become from a trainer or from a human one. As you can see here, for example, rotavirus is a lot of times from humans. Or the flu, which is a chronic one here, but I think with the respiratory therapies you can get out of them. I always check the other source panel if they have any remedies here, or the bug flowers. I always do it because I tried for cats bug flowers and also for one dog, and it can be good, very good for them. I always prepare from 4 or 6, which shows as the adductor or the SCIO. For example, you can see that he was a bit afraid, fear of losing control of the mind and desperation, that he was here a bit. You can make in a water, in a cleared water, for times from the cherry plum, for example, for the wild rose, for the chestnut bud, and these are acute. These are now at the moment, these feelings. And if you go up, there are the chronic, the deep problems. So you can also cure with the bug flowers here. As you can see, because of the races, he has a bit of exhaustion, mental fatigue, and you can also see that he can't concentrate. And if you make a mixture with these Bach flowers, it could be better. I always check the diseases here. As you can see, he has foot pain. And I could see by a lot of horses that they had some problems with the bladder or the kidney. A lot of times when I see here problems which were also told by the owners or by the trainers, I also treat it with the treat program. You can push on the problem and you treat it here. A lot of times you can see by race horses that they have some problems with the lung. It can be because of the breed. It's a huge problem for the horses. It's an illness for this breed, but especially for the race horses, because of the high adrenaline level, they also have asthma or a lung disease. And if you treat it in the way of lung, it's good, but you can also help with the adrenal gland programs or with the hormone programs. So the treatment will be completed. So I also check the emotions. Here it's not here are not big problems, but sometimes you can see very interesting things here. And I also check here the flower essence, because here you can see also deep problems with the soul. For example, childhood issues, psychic protection, or broken heartedness. So these I also treat it, which are red. I'm always treating here with the treat program. You can also check the hormones if you know at the mean program that he has some problems or she has some problems with the hormones. As you can see, he has problems with the strong estrogen, with the estrogen hormone, because he's a stallion. So he has not a lot of estrogen. You also can see that he had a delayed reaction to injuries and inflammation. So as we saw that he had foot pains, we can think it over, that it could be this inflammation or injury could be at the foot, in the foot, on the leg. And sometimes I also check the virus. Because a lot of times, as I worked at the ambulance as a vet, I also could see that a lot of times when we humans had some infections, flu or something like this, a lot of animals came to us also with these problems. So when I started to treat with SCIO or with the adductor, I always checked it because it was for me also good that I thought without a SCIO before, and afterward I could check it with the SCIO, that it's really a thought that they can also get from us infections like this. Okay, and on the mean therapy, a lot of times I do the quick therapy, but I can tell you that at the adductor, the quick therapy is all of the programs are faster, but the quick therapy. So if I don't have enough time, I let it. But if I have time, it's a very good general program, the quick therapy. And in the quick therapy, you also can write a lot of things, which problems your patient have. And it's also good, for example, if your patient your animal have mental problems, you also can cure here with the mental focus stimulation and the positive mental stimulation or the dispel negativity. It's or will to win stimulation. It's very good before race, for example. Afterward, I check the risk profile, and as by the humans, I like to use at the dental the body and face scan. because I think the chakra therapy is very good to make harmony in the system. And you also can cure your patient by the soul here at the body viewer with the harmonized to divine light. It's also good. It's much stronger to make harmony here. And these, afterward, the body and face scan, I like very much these notices. Because here are important things, and I always test and treat here, which I think it could be good for the problem which the animal has. For example, after a training, it's a good when you treat with the cardiac treatment of weak and irregular heartbeat because you can harmonize the circulation after the race or after the training, a strong training. Also, here, as you can see, also it is written that he has some problems with the connective tissues and the bones. You also can treat here. Sometimes I use, by the reference, the reflexology therapy. But a lot of times, if we know the exact local point of the injury. I will tell you a story with a cat where it worked very good. Okay, after the dental. It's a difference as by the humans that at the risk therapy I don't use a lot of times. I use it rarely. The stress and cortisol therapy or the enzyme therapy here. Okay. And at least, which I also use, here we can use a lot of things at this panel. I always check and I always treat here what the eductor or the CEO says as. So now I would treat the frequency therapy. I also I always make the tri-vector therapy, and I always do the meridian therapy because it's also good for harmonize and for make a lot of energy for the animal. I also do the acupuncture pictures and consciousness form testing because you get a lot of information of that also. And if the horse has or the other animals have allergic problems, or if you want to make another therapy, for example, for the kidneys, for the injuries, for the circulation, or for the hormones, you can also make the hyperreactance therapy. I always write virus, bacteria, fungus, sugar, and dust. And here you can write in the area which you want to cure. I always write 2 or 3 or 4 areas. And the symptoms, for example, I write here digestive system or bowel flora, and here you can write in dysbiosis or digestive inflammation or enteritis. After that, I do always the spinal program, which is good for the soul also, for the nerves, and also for the connective tissues. So I do here the neuroemotional complex therapy. And afterward, I check the time therapies, where you can treat which your CO or your eductor tells us, or if you want, you can also strengthen the cure with other cures. For example, if this horse has problem leg, you can also clear with the connective tissues stimulation, or also with the adrenal dysfunction stimulations. And I always do for humans and for animals also the feel-good therapy. And at the feel-good therapy, I always can see that also the humans and also the animals want to play, wants to laugh, and they get really a better soul or mood. When we know that our animal has pain, you also can use the pain program here. And I always check the NLP therapy. One time it was really helpful because one horse, I will tell you about him also, had problems with the cooperation. He didn't want to cooperate with the trainer, and he didn't want to participate on races. So I made the unconscious choice of therapy, and the eductor told me that he has problems with the cooperation, so I could treat there also. And after that, he could participate on races. He had good results. Before this therapy, he couldn't. He had no measured or good results by the racings. Sometimes I also use the mental therapy here, the mental factor and emotion chart. It's also helpful because there you can also treat the hormones or the enzymes which are not doing well. If your animal has problems with addiction, for example, it's also good by the race horses because they are addictive to the adrenaline. You also can use the individual NLP here with the addiction therapy. Or, for example, by cats, it could be also a problem that they want only one food to eat. The other ones not. So it's also good for make better variations for the cat. And, which is very important, and I loved it very much, by race horses, trotter horses, the sport therapy. I always did it. Also the hormone panel, and also here the oxygenation, stimulation, coordination, flexibility, mind, body, and muscle building. When I made the first part, the hormone part, I always push on the oxygen stimulation, so it will be more strong. The therapy will be more strong. Okay, and one more thing, time therapies and music super learning. I also like using. Here you can see which treatments or which areas are blocked or which are to treat. And I forgot one thing at the body viewer program. I will show you also. Just 1 second. So the Body Viewer program is also a pain program or anti-inflammation program, and it's also very helpful. Here at the therapies. You can also use for allergy the allergy release auditory to to get out from the inflammation, the anti-inflammation therapy. Also, you can use the circulatory stress therapy after a training or after a race, for example. Pain release, it's very important. And you can also use the stress release program. And I have also a patient, a dog, who has problems with the digestive system. So it's very helpful to use the stimulate nutrition absorption therapy. So back to my examples. Olisan is one of them. He is a trotter horse, and he's an 8-year-old neutered horse. He had a problem with excessive sweating, very excessive sweating after trainings and after races. He had asthma and bad posture, very bad posture, because he had a cervical and sacral pain, mascospasm. I cured him with the adductor, and so it showed me that he had mascospasm and muscle inflammations with in the sacroiliac muscle and the trapezius muscle. So these two muscles are, the sacroiliac muscles are at the lower back, and the trapezius is near to the neck, so the upper back. As he is neutered, he had low testosterone level. He had lack of energy, anxiety, inability for cooperation, fear, and anger. So everything hangs together. As I told you, because of the sport racing, he had excessive function, or he has an excessive function of the adrenal gland. He has a high adrenaline level. That was the reason for the asthma and for the excessive sweating. After 5 cures, he had no sweating, he had better breathing, better posture, cooperation, tranquility, and he had better racing and training. I cured him every other or 3 weekends, because the horse is in Budapest and I live in Szeged, and as soon as I could, I came to cure him. Now a bit of statistic from the race form. As you can see, here are the dates of the racings where he participated. And here at this on this line are the times to make 1 round. So it's the speed. As you can see here, he couldn't trotter very good. He had to get out from the race because he didn't want to trotter. He wanted to gallop. We couldn't measure his speed. And here on 2nd of July, I began to cure him, and he could participate on the first race, where he could have a measured speed. And every second or third weekend, I cured him. So when he went to the races, he had even more and more and more speed, as you can see here. Here the document from Budapest, where he participates on racings. Here you can see the dates. I started to cure here. And as you can see, as I told you, he had no measured speed. And after that, he had better and better speed. He got faster and faster. And he also could be, he also could have, I didn't hear it. Here is the date, here's the distance, the start and result. What did he? And now a little video from the last race. He is here with the red ear protector, and his trainer is in the red coat. He got the 4th place. Here. How old is he? I cured him every second or third weekend. So every second or third week. I cured him 5 or 6 times, yes. Oh, yes, it was more or less 1 hour. Double program? I did the sport therapy. I did the sport therapy, so it's good for all of the things for the movement. We have to have the electrodes on the horse. So I made it with the halter, which I showed you. I tried when I had the SCIO and we did not have the new accessories. I tried to cure with the head electrodes, but it was not comfortable. It was very small for the horses. For dogs and for pets, I could do it. But I think with the halter or with the horse blanket, it's much comfortable. So now to Tesco Magic. I always cure with the electrodes. So Tesco Magic is a 4-year-old stallion. He's also a racehorse. He had very huge problems on the leg. He had a chronic injury. When I started to cure him, it was a bit better. He had a very swollen leg. All of the leg was very swollen because he had an injury on the leg. He had a wound which became infected. And he was more or less near to the toxemia. When I started to cure him, the wound was a bit better, or the leg was not so swollen because of the medicines, but it was not good. It was more than half a year. With this, he had this problem more than half a year when I started to cure him. So it was very chronic. He had also sacral pains with nerve compression, and also cystitis, bladder inflammation, bladder irritations. It was because of the flu virus, which he became from the trainer or for a person who was near to him. He had also lack of energy, anxiety, inability for cooperation, fear, anger, irritation. He had irritation because he is a stallion. He has more testosterone level. So he was not always calm during the cures. He got very easily bored. So my husband was who helped me and who entertained him during the therapy. After 5 cures, it was also every other or 3 weeks. It was the 4th photo when I started to cure him. He had a swollen leg. It was worse. And he had an opened wound. And he had lack of energy because of the inflammation. And after 5 cure, the swollen leg is begun much better, and the opened wound was healing. I made a statistic about the oxygen level in the cells. I think because of the inflammation and the nearly toxemia, he had a lower oxygen level than the 70. And afterward, I could see in the second cure that he got more than 80. And it is continuing. Okay, one thing I haven't shown you at the SCIO, because of the wound, I also cured him with the in the dental therapy, body and face scan, and here skin rejuvenation, and here the point probe scars. I always cured him when I met him with this therapy. And unfortunately, the eductor always showed me that he has a chronic and deep injury, so I could treat it here also. Now back. Now I want to tell you two examples about the ducks. Fanchi, who had chronic and huge liver and adrenal gland diseases. Doctors couldn't help anymore when I started to cure. My friend is also a vet, and she got to know this little dog. And she told me that that I should help because she had also discussions with other vets, and they couldn't help anymore. In the opinion of her owner was also dermatitis. She had always itchy and very red skin irritations during the whole summer because of the pollens. I could tell the owner that the chronic dermatitis is because of the pollens and which pollens. And as I treated it, it became better. So 2 summers long, she had no problems with the skin. Diagnosis for the chronic and huge liver and the adrenal gland disease was Addison disease. Addison disease is a huge problem in the adrenal gland with the corticosteroids and with the aldosterone and with other hormones. Which also made the liver ill and sick. As you can see here, she had a very, very high enzyme levels, liver enzyme levels. For example, here, alkalic phosphatase, it was 3,162, and it should be only 280. This old dog could live other 2.5 years without pain. We could stop the dermatitis, as I told you. And I cured her 3 years long, every other and 3 weeks, when I could come to cure her in Budapest. The other one, Zafira, she came after Fanchi for the honor. The owner is a very respectful lady, and she likes dogs very much. And I always cured both of them, Zafira and the owner also. Zafira has chronic diarrhea, enteritis, knee pain, thyroid disease, thyroid hypofunction, chronic ear inflammation, conjunctivitis, eye irritation, and cystitis, bladder inflammation. The chronic diarrhea is Zafira, here, King Charles Chevalier. The other one, Fanchi, was Shih Tzu. Caused by, the enteritis was caused by protein allergy, enzyme insufficiency, and bowel floor problems. Problems of the soul was anxiety, lack of energy, sadness, apathy, frustration, nervousness, and bargaining. And what I wanted to tell about the owner and about the dog, in each term of the cures, I could see that those feelings are similar to his owner because I cured them after to each other. So conclusion, in 1 year period, I cured her every other 3 weeks, 20 terms. I will continue it. After 4 cures, there was no diarrhea. We could see that she had more energy, better mobility, and better mood. Now, treatments of cats. Sorry, I don't understand it. One moment. Okay.
How often the treatment was done? Because if it take 4 months, 2 months or like that, she will dehydrate if she will still have the diarrhea. You said she needs 4 treatment. How often did you do these treatments? Because otherwise she will dehydrate.
Yes, yes, I understand now. No, she was not panicked. The diarrhea was, after 1 cure, better, and it became more better and better. After 4 cures, it was... yes, every 2 and 3 weeks. I wanted to cure more, all of these animals, but these animals are in Budapest and I'm in Szeged, so I could also only come every 2nd or 3 weeks. But finally, these cats are in Szeged, so Teddy, he's a blue British Shorthair, neutered, 7 years old. He had an accident. He was found deep in the garden. He was frightened and he had big pains in every movement. So he was brought to a vet where he had a lot of diagnostic exams, for example, X-ray, physical examinations. Broken hip was diagnosed and that the cat was beaten by someone. Cured by SCIO 2 times. With SCIO, I could see both of those problems. SCIO showed me fear to be hurt. The end showed me the exact point of the broken area. As I told you, in the reflex therapy, you can see it, and you can make it exact. Instead of 6 weeks, told by the vet, he was healed within 3 weeks. When first time I cured him with these problems, he didn't want to move, but after the cure, he went to eat something. He had a bit pains, but he could move. Now about Simba and Dennis. Simba, a creamy British Shorthair, 2.5 years old, and Dennis, you know him from the other photo. Dennis is a tabby, a British Shorthair viscous cat. He's 5 years old. After I wanted to cure them after the operation where they got neutered, and because I wanted them to heal faster. With the adductor, I could see the medicine which was given because of the narcosis. And I could also see that this medicine irritated the kidneys. I not even saw it by these cats. I also saw it by humans. That after the operation, when I wanted to heal them, I wanted to cure them to the faster healing, I always show the adductor and the SCIO always showed that the kidneys are irritated. These facts were said about him, about Simba, that he is very stubborn and he has to be given the borders. And I also saw it with the adductor. I made back therapy also, and it became better with the cure of the adductor and with the back therapy. Both of the cats, as you can see, can feel the vibrations. They are very sensitive, and that they got calm and satisfied very easily. Dennis is very close. He doesn't like if somebody disturbs him, even if it is his owner, like me. Adductor's opinion, lack of personal space. So I had to think about it that I don't disturb him very much. I think those cats are good examples that SCIO and Eductor are very helpful also in prevention. By these machines, you are able to see the possible coming insufficiencies, which are typical for the breeds. So you can preventively cure those areas. In case of these breeds, are the points, the areas, kidney, liver, skin, and joint. And now, thank you for your attention with this photo. I like this photo very much. I cured my horse, Talisman, when this dog came from the far because he could feel the vibrations and he didn't want it to go away. So thank you for your attention. Okay. If somebody have any questions, I will give the microphone. Is it good? No. Okay. I will go because the other one is not good. Okay.
I was a little bit distracted when you started the SCIO up because of the horse. I wasn't looking at you, and I should have been. When you first started and you loaded in the animal program,
Okay.
did you click on that it was the animal program at the bottom?
Yes,
under
yes,
the
yes, yes. It's my fault. I wanted to show you that. Okay. I always write. I always write the animal breeding, and that I use the animal protocol. And also when I cure a human who is, for example, a swimmer and participate on races, I also push for the sport enhancement. That he is a sporter. Meanwhile, other questions? Ezt most a végét nem értette. Yes, yes. Yes, because for me, the term is as long as for the humans.
Ha kérdeztetek, akkor kérdezek. Hogy veszed rá az állatokat? Mert ugye vannak a nyugodtabb típusú, meg a kicsit mozgékonyabb állatok, vagy akár nem akarnak ott maradni. Tehát mondjuk egy lónál oda van... Angolul? Bocsánat, akkor mondom angolul. So,
how you manage the animals to stay in one place. It can be like a cat or dog, but not all of them a very quiet one, you know. So how can you manage, for example, a cat that doesn't really want to stay on the blanket? So how you can make it that they will stay calm, even for the long session?
A lot of times when I start a cure, they get calm. All of the breeds, or the horses also. I only had one horse, the stallion, Tesco, who was not always calm. I got them, in this I get him, for example, food, or I ask for help to entertain the animal. By the cats, I always do it when they are lying in a location, in a position. I only just put the head electrodes on them. But now with the pet pad, it can be easy because they can lie on it.
But if they don't want to, so what are you going to do? Because the reason why I'm asking you, because I already tried to treat my dog. And one of the other questions is that, for example, it was a horse here that the two people were holding. So how the resonance of the other humans or animals can influence the result of the test, for example. If you hold a cat or you hold a dog, what is ensuring you that your resonance is not going into the test of the animal? Do you understand my question?
No. One moment, please. Because the microphone is disturbing for me. Mondhatod angolul, csak nem tudom a mikrofonból kiérteni. De mondjad angolul nyugodtan, csak nem értettem ki a mikrofonból, mert zavaró nekem.
So, one more time. So, if someone is holding either a horse, either a dog, either a cat, the resonance of the human will not interfere the test of the horse. So the result, what will come out of the test field, it's not including the human's resonance?
No, because of the electrodes, and I don't do the virtual testing.
Ah, okay. Okay.
With these new electrodes, you can do the fast calibration, as I told you when I started to calibrate.
Yeah.
No. I don't let it that somebody is always touching. For example, by the cats and by the animals, I only put the head electrodes on them, and they are lying just because they are.
I was treating my dog, and she all the time wanted to go away. So the cable was tightened, you know, the machine was moving, so I was kind of scared. But of course, I could do the test. But if there is a stranger dog or a stranger cat, it's not belong to me. So I have to maybe ask the owner to help me to keep the dog or the cat near to the machine. So then I'm not 100% sure that I'm going to get the result of the cat or the dog because of the touching.
Yes, it could be disturbing, especially when you make the virtual therapy.
Okay, okay. Thank you.
I try to show you the animal breathing. Yes. Yes, but I'm just not hearing. I understand, but I'm not hearing, so I come here. Yes?
If it's a very small animal, I then put a cushion in the back of the cat carrier so that they have to be on the pad. I use animal pads. And if it's a dog, I actually use I do tie them.
Yes.
So it's got to be tied.
Yes.
And the friend of mine, I left her with the dog before. She said, I'll hold him. So she had him. And I left the room. And when I came back, I actually knew she had touched the dog because she'd been out drinking the night before and she just put one finger on the dog to stop him moving. And she had given the dog alcohol poisoning. And I said, "You touched the dog."
Yes.
She said, "How do you know?"
Yes.
You must not touch the animals
Yes,
when
yes.
they are being tested.
Yes.
But the cages are the best way. The cages are best.
Yes, and if you cure when, for example, they are lying and they are relaxing, and in a lot of cases, I think with the SCIO and with the adductor you can make calm. That's the reason why I make the kidney stones also, because with the kidney stones they get calmer. And I also see a lot of times by humans who were touching other animals, and these animals got vaccines. And I can see, for example, the parvo vaccines, I can see, or the rabies vaccines, I can see by the humans, and I always tell them you were touching whether either a cat or a dog. Yes, it is so. Any questions?
Annyit szeretnék hozzátenni, hogy én is kezeltem állatokat, macskákat és kutyákat, és az a meglátásom, hogy az állat, ha saját fekhelyére fekhetik, tehát hozzák bele a plédet vagy a saját kis kosarát, még ha idegen helyen van, akkor is tudja, hogy ő neki valamiért most nyugodtabban kell lennie. És ez nyugtatólag hat rá. Ez az egyik. A másik fele, hogyha kezelés közben azt vettem észre, hogy az állat nyugtalan lett vagy menni akar, akkor én ebből azt a következtetést vontam le, hogy valamit rosszul csináltam, hisz nem tudom megnyugtatni, hanem inkább még mozgékonyabbá teszem, tehát ő menekülne abból a szituációból, amiben én hoztam. Tehát változtattam, és addig kerestem, amíg meg nem találtam, hogy mi az, amivel meg tudom nyugtatni. És amikor elértem, akkor tudtam, hogy jó irányba haladok. Tehát meg kell keresni azt a kezelési módot, meg azt a programot, amivel meg tudom nyugtatni. Ha megnyugtattam, megfogtam és ott marad, és onnantól kezdve az állat elviseli, sőt, szeretni fogja, és kéri a kezelést.
Okay, he's talking about that, what I also told you, that a lot of times they get calm when we are using SCIO or the adductor, and when he had some examples when the pets were not calmer, they got more nervous. He found out they looked after some protocols to get calmer. So you can find, as I told you, for example, the relaxation therapy at the body viewer, or the harmonized therapy, also the chakra therapy, a lot of things. You can and with the one thing about the bug therapy, I used it for cats, and it's very good if you put as a spot on the neck, on the skin, and they get also calm. For example, the emergency rescue remedy from the bug therapy, you can put 2 times, and they get calm. Other questions? Yes? Yes?
So the question is, can you work on marine animals, on whales and dolphins?
Yes.
And
I don't. I haven't done it, so I don't know. I don't know about that. But I think it could work. It could also work. For example, because of the water, when you get the vibration, when you get the vibrations in the water, It can be very helpful.
Oui, bien sûr, bien entendu, puisque de toute façon, ils sont dans l'eau et que la vibration sera reçue à travers l'eau et pourra atteindre les animaux.
Yes. I think also the bug therapy. The bug therapy? Yes.
Flowers.
Yes,
Oui,
the flowers,
et
yes.
la thérapie
I
de
think.
back également.
Yes. I use it for the animals.
Okay. I did work on a wolf last summer. I did work on a wolf. Overnight, there was like a huge ball that came out of nowhere. And my friend went to the veterinarian who said, well, I have to have surgery on him. I have to remove it, clean it, disinfect it, and all that. $300. It was in Albuquerque, New Mexico, in the US. And I did work on him through the program. The next day, it started fainting.
Yes.
And it just diminished. And the ball was as big as a baseball. And then it just disappeared.
Yes, yes. As on the leg from the Olisan, it was quite the same.
We never knew if it was a parasitic, a nest, or if it was due to parasite or worms or a clutter of, some type of parasites. We never knew, but blood and, plasma started to swint outside.
Yes. Okay. Yes. Okay. Now I want. I try it. Oh, okay. Okay. It works now. I can show you. I also use the homeopathic program. I will show you this also. And there I can show you also what I also did with the Zafira who has enteritis. Viktor. Nem, megvan. Now I can show you at the demographics. Here, the animal testing, I always do it so. And there you can click or push whatever breed you want to cure. For example, here, horse, cat, dog, also the cows. And afterward, with the horses, I had a bit problems to write the exact water which they drink. And I found out that I will write in 100 because they drink a lot.
It comes up with animal test. Do you do the animal test and the other test?
No. No, I only do the normal testing because of the new accessories.
Okay.
With them, you can do it so.
If you just click on
I only know, I only do. Here, the fast calibration
see,
program.
it doesn't come up on that. It used to come up on the SCIO with a different test for the.
Yes, I know, but I do it now with the CO also, and with the head accessories. I also did it fast track calibrations, or I did it with the virtual testing, animal testing, and I always put on the CO some hair from the animal.
Okay.
When I do the virtual testing,
Okay. All right.
to be more serious. Okay. One moment, please. Yes? Yes, on the metal, on the surface. I only put a little of hair on the CO, on the board. So for Zafira and for Fanchi, I always did at the homeotic panel a water with the homeotic vibrations, and it was also good for them. And the owner is, as I told you, very respectful, and the owner always came to me with a huge bag of minerals, vitamins, and food. So we could check, for example, at the food, we could check which is allergic or non-allergic for him. And also the eductor always showed us, for example, that it's not good for her when she eats tuna or lamb. Here, the feedback homeopathic activation, I always clear here the potencies and put the water on the CO and load the homeopathic remedies list. And it will show you, I click all of them. You can see here which vibrations are here. Which you put on the water, and afterwards start treatment and duplicate it. And also here I could check all of the minerals, vitamins. It's always a question by the horses which minerals or which vitamins are lower than it should be. So I always check check the minerals and the vitamins here at the mean program. And I also can, it was also sometimes that I checked, for example, calcium, different types of calcium, so I could see which is good for the patient. Any other questions? Okay, then thank you for your attention.